Hi, my name is Dr. Naveen Thiagu Bashingam. I am an orthopedic surgeon at Alpha Ortho Clinic, Puducherry. My interest in orthopedic surgery are joint replacement, arthroscopy and sports medicine. In orthopedic surgery is to preserve the joint as much as possible, to repair and reconstruct the ligaments which are torn in the joints, and if the joint is completely worn out, I would prefer doing joint replacement surgery. In these videos, I am discussing some of the most frequently asked questions by patients who are planning to undergo joint replacement surgery. The most frequently asked questions by the patients is, why do I require joint replacement surgery? A joint replacement is required when the cartilage lining the joint becomes completely worn out. For this, I'll take you through a bone model in which I will show you the parts of the joint and how this wear and tear happens. If you see this model, you can see the thigh bone, the end of the thigh bone and the end of the leg bone participating in this joint, which is called the knee joint. In between these two bones is the soft shock absorbing structure called meniscus, and if you can see in little closer, this shiny surface lining this bone, this is called cartilage. This is the most important and vital part of the knee. As this cartilage wears out, I will show you in subsequent models how this wears out. So, as this gets worn out, you will require subsequent treatment of joint replacement surgery. In this model, you can see the lining of the cartilage, patchy loss of cartilage in the joint surface. This is the early osteoarthritis, early wear and tear of the joints. During this time, the patient will start having pain during exertional activities or mild to moderate activities. So, this is an early stage of wear and tear of the joints. Here you can see there is huge loss of patchy cartilage getting lost from the joint, and under the cartilage the bleeding surfaces are exposed. As such, cartilage will never, on rubbing each other, will never produce pain. Why? This is because the cartilage does not have a nerve supply. But once the cartilage loss happens, the underlying bony surface has innumerable number of nerve endings. These are very sensitive, and this produces huge pain, and this stimulus directly goes to the brain. So, as this rough surface rub each other, it produces huge amount of pain, and in this stage it is moderate to severe osteoarthritis. This stage, clinically, a patient will complain of swelling of the joint, severe pain even on daily activities, stiffness of the joint, and at this stage your doctors would have advised to go for joint replacement surgery. The next model, I will show you the components of the joint replacement. In this model, you can see the joint replacement done with the component in the model. So, as I told you, the one end of the bone is covered by a metal, and the other end of the bone is again covered by another metal, and these two surfaces are kept apart by a plastic component called cross-linked polyethylene. Apart from this, in the real bone, the patella or the kneecap cartilage surface also is replaced by a plastic cap. This put together is knee joint replacement. For more details on patient testimonials and the number of surgeries that I have done in joint replacement, you can check out our website www.alphaorthoclinic.com and www.drnaveenthiagu.com.